Okay. A very good evening to all the participants. Hope you can hear me. Okay, so you all know that we are having this new module on Nosodes and Sarcodes. So I think the dates has been extended for 2 more days for early bird offer. So whoever has not yet registered for the module, you can do it as soon as possible. Mostly, I think the date has been extended to 20th, that is tomorrow. So whoever has not yet registered for the module, you still have the chance to register in the early bird offer. I think that is 50% off. And also, if you have not yet read the books Decoding Mental Rubric and Nosodes and Sarcodes by Dr. Gaurang, you can write to me and you can get your copy.
Hello,
Hello,
how are you?
all well.
So, a few people have joined us today.
Yes,
Namaste and pranam. How are you doing, Dr. Pratik?
yeah, doing good.
Okay, you look happy. Some good things happening in life, looks like. So, gradually, a few people are joining us, and it would be good to start the session very soon. I wanted to announce a couple of things before we start. Um, by the way, Pratik, next week, Vaika is going to join us from Germany. She's a very well-known teacher from Germany, um, one of the leaders in Germany of sensation method. She's going to join us and she's going to share a case beforehand. So once she sends
Okay.
the case, I will ask Yash and Pratik to share it on the group, and then you can study it. So it would be good. We are trying to invite different homeopaths um, to our sessions, and if you feel that we should invite anyone specific, please write to me and Pratik, and we can maybe invite someone. What do you feel, Dr. Pratik?
Definitely.
If you feel that there is someone who we should invite, that will help increase our knowledge and we can get to know about them. That's the whole
Because
idea.
there are many clinicians which we don't know in different parts of India. So it will be good even for us to
Not
learn
just
from
different
them.
parts of India, Pratik,
Even, yeah,
all over the
different
world.
parts of the
Some very
world.
very
Yeah, we
interesting
don't know.
people who are doing some quite good work together. So yeah, so that's why I'm excited about learning from Vaika. She's going to show some very interesting cases of sensation method and how she uses it in Germany. So it would be good. I'm also going to invite someone from the US in the coming time. So there are going to be a lot of people joining, and that's why I told you that if you want us to invite someone in Materia Medica series, which is a commitment that we have with you every Thursday, we will have that. And if you want Dr. Pratik to talk about miasms also, you can request him so we can invite him to talk about miasm, because it's been pending for last so many months, and he has been preparing Dr. Pratik on the lecture on miasms, and he has been just waiting. He says whenever people actually call me and who will be really like passionate about learning miasm, he will be there. So if you want to really learn miasm, you should be catching Dr. Pratik, really hounding him, torturing him with your messages that Dr. Pratik, please make it happen. Okay, so sounds good. I think this is a good time to start the case.
Yeah.
And okay, so I hope you can see some part of the PPT. Okay. So Welcome to Materia Medica series, and we are continuing this. We are continuing this until we are alive. We are going to continue this, inshallah, God willing. So I hope most of you have got the case for today, and um, the case is very interesting. Maybe some of you have got the cases beforehand. Did most of you get the cases beforehand to analyze? Say yes. We have Shah Homeopathy, Dipesh, Riva, Purvang, Shrushti, Berard, Neil. How are you doing, Neil? Let's see some more people. Arshi, Sheetal, Andrea, Meenakshi. कैसे हैं मीनाक्षी जी? Nagesh, Nagesh, please invite Dr. Sarkar. We are going to planning to invite Dr. Sarkar sometime. Huh? Vinila, Santosh Kumar, Archie, Veer Davinder, Krupali, Meenakshi Gauli, Dima, Mahesh, Nida. No case doesn't open for me. Oh, talk to Dr. Yash if you can't find it. Tejasvi, Pratiksha. सोहेल कैसे हैं सोहेल डॉक्टर फाटक सुनीता सुनीता शर्मा so yes we are already having more than 100 people live watching us right now so let's start with the case like always I am going to tell you the case and towards the end of the case I hope that I get to know your views about the case and then I will try to give you whatever remedy I have given these are all very very clinical cases I don't want to make it like a seminar but something like a workshop and that I find is a calling of my life where I feel that to tell you the innermost way of analysis in a very pure classical way is what I feel I want to do all my life and help patients today I was studying one case from Europe who had COVID and the only symptom was that this patient in the COVID used to feel lot of chilliness in the bones. Are you with me? Chilliness in the bones. Dekho. What do you think is the remedy? Chilliness in the bones. Any idea? So if you put coldness in the bones, and there are many remedies, but the main remedy that you can find, okay, you can see patient feels cold to the very bones. Dekho, this is Patak Materia Medica. And the remedy is Arania diadema, spider remedy. Very important remedy. Very, very important remedy. That's what I gave in a case of COVID in a part of France. So this is the real clinical homeopathy that we are practicing, and we are trying to help a few people. And I hope that some of you and most of you, whoever need my help in cases of COVID, I am able to offer it to everyone. And in last 6 months, we have treated hundreds of COVID and suspect COVID cases with good results. So if you need my help, I will always be there to help you. You have my email ID. Okay, let's come back. So we are talking about a case of 26-year-old lady uh, who has suddenly developed anxiety and panic attacks since last 4 years. Okay, so this is a case of anxiety and panic attack, and it has started after death of a friend. And after that, she's not been able to handle her emotions, coming to face with family. Um, Family couldn't handle her as well, but they treated her not so well and she has not been able to handle herself very well and there's a lot of anxiety and panic and the allopathic doctors have been suggesting to take psychiatric medicines. What were the initial symptoms? So I tried to form the portrait of the disease. What are the initial symptoms? A lot of headache, throbbing pain in the temple region with numbness of the right side of the face. So this is very peculiar. Headache, throbbing in the temple region, then there is numbness of the right side of face and right side of hand. No sensation in right side of face and hand, with lot of shortness of breath, sensitivity to light, palpitations of the heart, dizziness, sudden cold feeling in the throat, sudden cold feeling in the feet. What is the present situation? A lot of breathlessness, shortness of breath, a lot of breathlessness, especially overthinking, over analyzing about health. When thinking about health, and she's very, very, very anxious about her health. Better by deep breathing, better by listening to meditations. A lot of dizziness, not being able to focus, feels everything is moving. So Shreyas and Priya. Shreyas is suggesting Ignitia. Priya is suggesting Causticum. Don't do that, Shreyas. Don't do that, Priya. First, analyze the case. पहले केस को बारीकी से समझिए. Try to understand the case in detail and then try to analyze. Lot of palpitation on going to sleep, palpitation of heart. And when palpitation stop, there is a lot of jerking. Coordination of muscles is not very well. Occasionally, while walking, suddenly feels there is imbalance and feels a little disbalance. Rahul Sharma has joined us. Rahul, I would like to know your analysis of the case. So please listen to it carefully and tell me the analysis. Tell me your suggestion. Suggest your remedy. Back and neck stiffness. All reports are normal, but still there is a lot of anxiety, panic, neck stiffness, pain in the neck, pain in the upper back, dull pain aggravated by rising, better by warm bathing, better by massaging, better by ice pack, better by deep breathing. Pain in the coccyx, dull pain aggravated lying on hard region. Sometimes there is a lot of pain from neck going to the right arm, numbness of the right arm, radiating pain, pain in the right knee. Sometimes not able to keep the legs straight. Lot of anxiety, sudden breakdown. Sometimes weep without reason, not being able to sleep. Past history of chicken pox, malaria. Family history, grandfather CA lung, father BP, mother anemia. How did the problem start? Stress before the complaints. As a teenager, felt as if family didn't treat me well. Everything revolves around the family, interestingly. As a teenager, felt as if family didn't treat me well. My sister started judging me. I started drinking. My sister was unsupportive. They used to check my phone. There was no privacy. They would keep checking on me. And that would be very, very restrictive and suffocative in a way for her, where they would constantly keep checking, what are you doing? Which boy is there? What are you doing? That she couldn't tolerate. Feeling as if not being able to control her life. Too much of interference. That was problem. Too much of interference in her life. Everything was decided by other people. Continuous under control. No decisions to make by herself. Can't come late at home. About her nature, she says, very, very calm, soft spoken, understanding, likes to encourage other people. Even if there are differences between sister and her, can handle it. Is very accommodative, emphatic, very, very sensitive. Or what when other people decide her things, feels bad, feels she wants to attack. She doesn't like being interfered. If someone judges her, she cannot tolerate. If someone assumes her, she cannot tolerate. If someone makes fun of her wealth, doesn't tolerate. Gets very, very angry if someone decides things. She doesn't like authority on herself. And if someone doesn't give me freedom, so her one of very important word that she uses is freedom and restriction. Okay. If someone doesn't give me freedom, I don't like it. When people try to manipulate you, I don't like it. In anger, I just speak. I will call my boyfriend, I will call my friends. But I cannot tolerate not being given freedom. Lot of fear of death, fear of anxiety about health, fear of death about family. Again comes back to family. Fear of loved ones, fear of high places, fear of ghosts. Stress, anything related to my health, anxiety about health, something bad will happen. Stressful situation when her friend died, felt dizziness, couldn't tolerate, started getting many, many palpitations, scared, grief, sadness. When family was not treating me well, I felt very alone, forsaken. alone with family but no friends, always want support of friends and family, but I didn't get the support. I felt I didn't get the support of my friends and family. What dreams do you get? I get dreams of friends listening to something, dreams of loved ones. But one constant dream I get is dreams of teeth are falling out. What do you feel in the day? I feel scared, panicky, a lot of fear, confusion. What are the things you enjoy doing? A lot of interests related to makeup, traveling, exercise, music. As a child, was very shy and very attached to family, and has a lot of desire for spicy and junk food. Very thirsty, gets up very tired, and with a lot of problem during, before, and after menses. So a lot of doctors have joined us just recently. Valeska, hello Valeska, Louisa, Anand, Komal, Telma, hello. So just for the new people, I'm going to just very briefly tell you the case again. We are talking about a case of 26-year-old girl who developed a lot of anxiety attacks and panic attacks, and everything has started after death of a friend and family not treating her well, and she developed a lot of throbbing pains and numbness and shortness of breath and very sensitivity. um, this is more when she's anxious, better when she's meditating. Lot of dizziness also, palpitation, jerkings, coordination, vertigo, stiffness, joint pains, numbness, paralyzed feeling of the arms, pain in the right knee, anxiety, breakdowns, stress is she doesn't like being judged, being restricted, being interfered, intruded into a space, doesn't like people taking control of her, need for freedom, and need to do things on her own, feels suffocated if people tell her what to do, constantly needs freedom, anxious about health. If someone doesn't give her freedom or space, that affects her. Fear of death, anxiety about health, about family, about ghosts, constant anxiety about health, palpitation, constant feeling of being alone, dreams of teeth falling out, and more or less this is the case. So let's see some of your suggestions. What are your suggestions? So I think a top suggestion is carcinosin, and I think the reason for it is because they feel that I'm going to only teach you nosodes and sarcodes. One doctor wrote to me, I think the only thing you know is nosodes and sarcodes. That's why you keep teaching that. Maybe he's right. Okay. So one of the suggestion is Komal, pneumococcinum. Interesting. But I don't see indication pneumococcinum here. Veer, Kali, Tejaswini, anacardiaceae. Okay. Munazza Vagu, carcinosinum. Okay. Abhijit Dhawan, Proteus. Okay. Let's see. Some more suggestions. AIDS, Ruchi. Vibur, Bambusa. Tuberculinum. Vidya, can she be fluorine? Okay. Med perspective, carcinosin. Meenakshi, Coculus. Thakkar Komal, she wants freedom. Okay. Sunita, Argentum nitricum. Interesting. Let's see some more suggestions. Nida Muzammil, can it be a plant? Shubham, magnesium. Mrudul, argentum. Sunil, carcinosin. Okay, let's see some more suggestions. Aisha, Simisifuga. Okay, so I will want to tell you what I did. In this case, what is the main thing in the case? The main thing is anxiety. What is the anxiety related to? About health. about family, about friends. Do you agree? And the other theme is that she doesn't like the idea of being intruded, restriction. She needs freedom. And even in the dream, the feeling is of breaking off. Teeth are breaking off. So this is the main thing in the case. The remedy that we choose has to have all of this. So on this basis, one very peculiar thing in the case that I saw. Let me show you in the repertory. And if you have a look at the repertory, and I opened one of the first rubrics in the case. Let's have a look. Dreams of teeth breaking off. Can you all see this rubric, everyone? Can you all see this rubric? Dreams of teeth breaking off. There are 12 remedies here. And if you see which remedy kind of is shouting at you from this rubric. So there are many remedies. There's thuja, pteridion, nicolum. But is the patient thuja? No. Iridium, ephedra. There's a very interesting remedy that I see, which is given in Kent. And the remedy here you can see is Kali nitricum. Yes. So now when I repertorize the case, and I hope some of you can see the rubrics. Okay, I hope some of you can see the rubrics here. You can see the rubrics that I've taken. Dreams of teeth falling out. Dreams of fear of death. Numbness of upper limb, numbness of upper limb left. Jerkings, anxiety with palpitation, anxiety with headache. And you can see the remedy coming up. Kali nitricum. Nitricum also has a theme of restriction and suffocation on one side, and freedom and liberty on other side. And you can see the anxiety of Kali. So that's what I gave. I hope some of you can see the rubrics. And that's what I gave. Very interesting case. I gave Kali nitricum 200, 2 times a day for 7 days. Maybe some of you can see this. Kali nitricum. 200, 2 times a day for 7 days. Very interesting. And just within a month, her anxiety and cervical pain, and she was going to go to psychiatrist, and they had suggested many medicines, and with her joint pains and everything, they reduced by 50%. Her stiffness, her back pains, her radiating pains, her burning, everything remarkably changed. Her state of mind is much better. She's much more positive, confident. Her emotional health is better. Her mental health is in a remarkable change, and so on. So we will talk today about the remedy, Kalium nitricum. Are you ready? Say yes. So let's try to understand the remedy for today, Kalium nitricum. All right, let's do it. So Kalium nitricum, nitrate of potash, belongs to the mineral kingdom. Yeah. And you can see here, very interestingly, that nitrogen comes into the row 2. This is row 1, hydrogen. Hydrogen and helium has to do more with conception. Do I exist or no? Hydrogen patient will often feel, do I actually make any difference in this world or no? Do I exist or no? Then you have row 2. Here you can see lithium, someone who's very dependent. Carbon, who's a little bit of state of dependent but wants to break free. And then you see nitrogen, who feels very restricted, suffocated, and wants freedom. And you can combine this nitrogen with Kali. So anxiety. Row 4 has to do with family, security, health. So you see Kali nitricum, which means the anxiety, the insecurity of Kali connecting with the feeling of restriction and need for freedom of nitrogen. And this is Kali nitricum. So interesting, no? Hello? Where are you guys? Komantalevu, where are you? Okay, you're there. Okay, it's cool. Okay, so let's try to understand the real picture of Kali nitricum. Yeah, I want to teach you the main themes of Kali nitricum. There was a lot of proving which was done of Kali nitricum and gunpowder. Interestingly, gunpowder has Kali nitricum as one of the main ingredients in it. And the main theme was that suffocated by people around me. You can see here, suffocated by people around me. Feel that they are not good enough, that I am not safe here, feeling that I should reach home as early as possible because anything can go wrong here. Feeling of suffocation by people around me. Lot of anger on smallest of things. This is very important. Anger and anxiety on smallest of things. So one of the very important symptoms of Kali is smallest or trifles aggravate. Kelly is also very angry and abusive, expressing anger. This is a very important thing. Sometimes people ask me how to differentiate Kali and Calcaria. Kali are very irritable, very impatient, very hyper, while Calcaria is very calm, cool, no problem. It's very easy to pick up the differentiation, actually. Let's see some more. They are very irritable at being disturbed. Kali nitricum also came in the proving. Irritable at trifle, continuously thinking about an infant whose mother had committed suicide, wondering what would happen to it and who would look after it. There is a lot of insecurity. It's a typical Kali patient, lot of nervousness and anxiety about future, about not knowing what will happen. The important word is feeling of not being stable. Sudden nervousness with internal tremulousness, tremendous anticipatory anxiety, fear of ghosts, causeless anxiety, lot of insecurity, unknown fear, strong feeling of nervousness, strong feeling that body part is brittle, strong feeling of insecurity, strong feeling that they are very delicate, like Thuja. Kali nitricum also has a little bit of feeling that they are delicate, like Thuja, and that's why they are very anxious about their health. Very important rubric of Kali nitricum. Dreams of teeth are breaking off. Also there in Thuja and Theridion. Want to escape, dreams, want to escape, but his legs are too heavy. Also Kalium nitricum. Dreams of falling. Also you will see Thuja. So you can see a lot of differentiation between Kali nitricum and Thuja. But the only difference is in Thuja, Thuja is a state where they want to kind of hide, or they want to kind of avoid the inner kind of feeling of incapacity. That's Thuja. A lot of dreams of quarrels. Wherever there is a quarrel, sensitivity to quarrel, that is Kali. All Kalis are quarrelsome. And another very important thing about Kali nitricum is irritability if they cannot eat, and irritability eating ameliorate. This is Kali nitricum. Kali nitricum. Another important remedy is ammonium muriaticum. Maybe I will teach you that remedy someday. Very important remedy for knee rheumatism. So lower limbs, knee, meniscus, patella pain. Lot of weakness. Kali nitricum is one of the most weakest kali. In the morning, they feel lot of weakness with sensation of heat on the face. Great debility when sitting, but gets better on exercising. Kali nitricum. Very, very important for asthma. Asthma at 3 a.m. Along with Kali Kav, another remedy is Kali nitricum. How to differentiate? I will teach you. You can see 3 a.m. aggravation is a very strong symptom of all Kalis. You can see Kali Bai, but that sticky sputum will be there in Kali Bai. Kali Kav, always better by sitting up. And Kali nitricum has always a feeling of suffocation. Asthma. Kali nitricum is a very important remedy for asthma. And because it's a very important remedy for asthma, it's also a very important remedy for COVID cases of asthma or breathlessness. Difficulty in breathing. So, drinking when causes aggravated in asthma. Difficulty on lying down. Difficulty lying with head low. Interestingly, Kali nitricum, one of the worst position is standing. Standing is the worst position, Kali nitricum. Peculiar cough. They get up from the cough. And a very important symptom is 2 a.m. cough in Kali nitricum. 2 a.m. cough. Remember, 3 a.m. also Kali nitricum. So you can see they get up from the sleep with a cough. That is Kali nitricum. 2 a.m. and 3 a.m. Remember Kalis. 4 a.m. and 5 a.m. Remember nitrums. Okay. 3 a.m. aggravation. You can see Kali Ars. Kali Ars is much more anxious. Kali Carb. Kali nitricum. Paralytic weakness of the leg. Weakness of the calf. It's a very, very important remedy for neurological cases. Weakness of the foot while walking, while standing. So very important for kind of fibromyalgia, lower motor neuron paralysis. Rheumatism of the leg. Pain in the leg going to the toes, ankle pain. Aversion to coffee, Kali nitricum, very important. Aversion to coffee. Kali Kav has craving. Desire for cold drinks, very important. Cold food aggravates. Fat aggravates. Aversion to food. Their appetite is not very high. Kali Kav has a very high appetite. Smoking and tobacco aggravation, Kali nitricum. And very important symptom, veal aggravate. This is a typical type of a meat which they use, which they eat in the West. Veal aggravation, very important. I hope you remember this. So this is a little bit about Kali nitricum. Let me just tell you a little bit more about Kali nitricum. Kalium nitricum, so that you really remember it forever. So it has a very good action on respiratory sphere, like we spoke about, kidney, heart, blood vessels. And it's very important for secretion increase into cavity. So lung, pleural effusion, very important. Also very important for suppurative nephritis, asthma and cardiac asthma. Important symptom is sudden dropsy, sudden swelling in the body. Pains are dull stitching. Stitching is a common sensation of Kalika. Relapsing phthisis, so relapsing tuberculosis, and that's why relapsing COVID cases. Think about Kali nitricum, hemorrhagic tendency. I told you there's a lot of lack of interest and a kind of feeling of disinterest in this remedy. Very, very important for asthma. Sits upright with a lot of burning in the chest and lot of thirst, but still can only drink with a lot of patience. And there is dull stitches in the chest. That's very important. And free expectoration will help. This is few things about um, uh, Kali nitricum. Another very important symptom, better by gentle motion drinking water like causticum, and worse by cold, damp, taking cold, lying with head low. So always want lying with head high. This also is calinitricum. Palpitation worse lying down, and also a lot of pain in the epigastric, a lot of nausea at night, and tongue is red like ossimum canum, and very important for polyps. Hmm? Polyps, nose polyps also. Chronic deafness from paralysis of auditory nerve. In chronic cases, you can think about it. And angle of the right eye twitches while chewing. So this is a little bit about calinitricum, and a little bit about one important theme I want to tell you about calinitricum before I finish. Let's see. In calinitricum, there is also fear of threat to his family, threat to his family, who is like a security for him or her. And in this kind of patients, you see a lot of anxiety. They are one of the most anxious kalis, along with kaliyars. So this is a little bit about calinitricum. I want you to email me what you learned about it today. Calinitricum. My email ID gaurang@gmail.com. And I'm very, 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 very excited to tell you about my course, that is Materia Medica of Nosodes and Sarcodes and Bowel Nosodes. And I want to first of all thank you for an amazing response. We already have more than 250 doctors who have joined us. And it is just absolutely amazing that so many of you have joined us. And this is the first online kind of school. I want to open an online school for all the doctors. So anyone wants to learn anything, they should be able to open my website. Just like Netflix, you want to watch a romantic movie, you want to watch a Bollywood movie, you want to watch a crime movie, you want to watch any movie, you should be able to watch it. And I want to develop that on our website, where you want to learn basics, you want to learn organon, there should be a course. There should, if you want to learn the whole materia medica, there should be a course. If you want to learn just nosode sarcode, there should be a course. And then I'm also going to try to develop a kind of a master class course, where if you learn this 100-hour course, you will become like a real master. And I'm going to put all my heart into this, because this is so very special and important for me. So I hope that I hope all of you who have not joined this course, Nosode Sarcode Bowel Nosode, which is going to start from 27th of November. So you don't have to join from 27th of November. You can just you can just book your seats. You should know that the course fees is 2000 rupees Indian rate, and it is at a 50% off, which is at 1000 rupees. For exactly next 48 hours. So after 48 hours, the rates will be 2000 rupees. So if you have not joined this course, please join the course. This is one of its kind. I have put my everything. It's going to be 10 hours. I'm doing 10 hours of just every remedy, nosodes, every nosode, every sarcode, every bowel nosode. And Yash tells me that I have spoken about almost more than 40 remedies and its clinical indication. So if you do this course really well, um, the reason why I believe the course is very important, because I am teaching you through cases. And when I'm talking and when I'm telling you from all my experience, from everything I've learned from everyone and from my heart. So it's going to be a little different from the reading the book, because when you're reading the book, you're just reading it like this. But when I share with you the cases and what it means, and how to use pituitary gland in cases of stroke, and how to use um, tuberculinum aviare in cases of COVID, and how to use serenum in cases of stomach cancers, and how I used it, and how to use Morgan Pure in very difficult cases of gallstones. When you see these cases, and I've called a lot of panel of doctors to discuss about this, when you actually hear this and see how I do it, it's a different ball game altogether. And that's why I want to invite all of you to join for the course. The last 2 days for the discount offer, I want all of you, every single one of you, to join the course. It's just a course we are doing for you. So please join it. If you are interested, write to me, gaurang@gmail.com. I'll send you all the details, and you should join it very soon. I look forward for you guys joining it. Also, my books are available: Decoding Mental Rubrics and Material Medical Nosodes Sarcode. If you don't have it, you can buy it from Pratik or Yash. And my new book is also coming very soon, where I've written about 8 different types of repertories, um, which is on the final level of editing now. 8 different types of repertories. It's a 500-page book. It's a master class on repertory. So if you're in love with repertory, wait for that book. So this is all I have for you. Email me today's talk, what you learned. Join the course wherever you are, whatever you're doing. Forget it. Join the course. Learn. If you want to invest on anything in this world, invest on education and increase your skill level and craft level. I have been doing it for last 15 years, and I have not I have not lost anything. In fact, I've gained more than I have lost. So you can see in last 10, you have been, most of you know me. You have been seeing me for last 10 years. How I started off just kind of as one of the person, just making notes and just being around good doctors. And just in 10 years, you can see the changes and in me and in my work, and where I'm able to make a little bit of a difference to in all of your life. And I believe that all of you can make a difference, but invest yourself, your time, your energy, your devotion towards the science, and this is the best that I can guide you. You have some questions about the costs and all, you can just write to me. If you're interested, write to me. Even if you're not interested, write to me. And if you cannot afford, write to me, I cannot afford this course. Okay, I want every single one of you to join it, because I am doing this only for you. Um, that's all I have to say. So, Dr. Pratik, are you there?
Yeah.
So, some vote of thanks. कुछ बोलेंगे?
Yeah, I would like to share. Yesterday, as Dr. Gaurang said, we had a small panel talk with the doctors. There is a small panel discussion in the end of this module, and I think it was just an amazing session to learn from all the different homeopaths through their cases. So the main important learning is, see, you will learn different materia medica from the books, but how to apply them in cases, I think that is something which we'll learn through the experience of a homeopath, how they choose that particular remedy in that particular case. So I think yesterday we had a good learning, all of us. So I think it will be a
Amazing. Amazing.
yeah.
I had
So
an amazing. We had a 2 hour of a panel discussion on nosodes and sarcodes, and we had invited doctors from all across India, from Rajasthan, from Amravati, from different places, and everyone was sharing their cases of nosode sarcode. This is part of the course of nosode sarcode, and we learned a lot of things. Like, for example, one of the very senior doctors with more than 40 years of experience, Dr. Nimbhorkar, spoke about how he uses Morgan Pure in case of gallstones with brilliant results. It's something I learned. I hadn't used it so much. So there's so much of clinical material in this panel discussions that we have put up. If you watch it, you're going to go to next level. So I'm very, very keen that all of you join. And Dr. Pratik, how was your experience in the panel discussion? It was amazing, no?
yeah, definitely it was amazing to learn about different remedies. I think see, many of as I told you yesterday, Dr. Alpesh shared a very good case of anthraxinum. So that was,
Mm.
I have never seen in any of the cases how to use it. So that was a good learning. So like all the teachers sharing their learning. So I think that
It
is
was
something
amazing, absolutely amazing.
you all
And I
should
want
not.
to tell you one more thing. We are going to invite a very, 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 very senior stalwart as a guest speaker for a few minutes in the webinar also, in the Materia Medica course also. You will come to know who it is very soon, because I'm going to be recording a lecture on Sarcodes with him. I'm not going to tell you the name for now. Just wait for 7 days more, and I will send a small little clip so that it will inspire you to join it as well. So I'm trying to make this 10 hours. This is like a full-fledged, exhaustive, intensive 10 hours of training of nosodes, sarcodes, and bowel nosodes. If you watch this, if you learn this, nothing can stop you then prescribing these remedies really well. And the best part also is that once you learn these remedies and you want to know where you want to buy these remedies, we have Dr. Pratik Jain, who with his pharmacy, you want, if you, many of you doctors, you feel this remedy is not available, you don't have the remedy, let's say Proteus, then you can write to Pratik, and he will, if he will find it in his pharmacy, if it's not there, he will order it from somewhere, and he'll make sure he'll send it to you. So it's like a, whatever you learn will not go waste. That's what we are trying to tell you, more or less. Am I right, Dr. Pratik?
Yes, absolutely.
So in fact, Dr. Pratik is making a small kit for nosodes, sarcodes, and bowel nosodes. Please tell us about that.
Yeah, so I think the as you rightly told that most of the doctors they have the same query that we have learned how to apply it, but the difficulty they face is in getting the remedy. So we are here to help you, whatever is required. So we are having most of those nosodes and sarcodes that Dr. Gaurang will be sharing in the module. So whoever wants that, I'll help you with those remedies.
Sounds good. So I'm very excited for all of you joining this course. If you have not, whatever your problem is, write to me. I want you inside watching this course. So see you all later. See you next Thursday. We are going to invite a German homeopath, Vika, and I hope you found today's talk interesting. Write to me what you learned about it. Thank you so much, Dr. Pratik. Thank you so much, friends. See you later. Namaste from Mumbai.
Okay, thank you, friends, for joining us today, and see you all in the next session of MM series next Thursday, 8:30 p.m. Indian Standard Time. Till then, take care. Bye bye.